everyone. Today is Monday, November 30th, 2020, and it's Dr. Wendy Fortna here with a bit of an update on COVID-19 and the situation evolving in special areas too, including the community of Hanna. As some of you are aware, there are currently 3 active cases in our area, including cases here in the town of Hanna. These individuals are not in our hospital. They are recovering at home and following all public health measures as they are required to do so. I had 2 questions come up this week. The first one asked me whether or not it was safe to take care of an animal inside the home of a COVID positive patient who is currently in hospital. This is an excellent question because it brings up the idea of transmission. So when somebody has COVID-19 disease and they're in their own home, they're obviously not going to be wearing a mask during that time. And so it's very likely that while coughing, sneezing, or just going about their daily tasks, they're leaving virus particles in and around their home. These particles can live on surfaces, depending on the type of surface, for many hours, days, or even weeks. So while it is very safe to go into the home, you're not going to catch the disease simply by walking through the air of somebody's home. If you're touching surfaces in that individual's home and they have been in there while infected within the last few weeks, then there are likely virus particles in that individual's home, and you could transmit them from your hands to your mouth or your nose. It is a very kind thing to do to take care of someone's animals, and so there are some precautions that you could take to try to protect yourself from infection. I would recommend that you wear a mask while you're inside their home so that you don't inadvertently touch your face with your hands after you've been touching, say, a cat dish or a counter. It would also be important to use hand sanitizer after you were finished in the home before you touched your personal belongings and items. I can't tell you any specific details about how long there would be infectious material available in the home, but you could check on that one. There you go. See, I get phone calls all the time, including while I'm trying to film my videos, but that's been happening a lot more lately than it did before. So the next question that I received was about violations of public health orders. We're all certainly under the scrutiny right now in our community, because we are a small community, to follow the regulations that the government recently put forth. This is in regards to people not having social gatherings in their home, as well as limiting outside gatherings to a certain number of individuals. If you wish to submit a complaint online about a business that is not following regulations, you can simply Google Alberta COVID enforcement, and the link is there with a form that you can fill out online. There's also a 1-800 number that you can phone to report a business which isn't being compliant with rules. This phone number is 1-833-415-9179. I imagine there are a series of prompts when you call that in order to indicate the information that you would like them to be aware of. I think that we're all aware of what's been happening if we've been watching the news with things like anti-mask rallies where people are having mass gatherings in public locations, as well as anybody on social media is faced with a plethora of messages about conspiracy theories, about COVID, about not needing to wear masks, and frustration about the government taking over. As a healthcare worker, I'm really concerned about these messages, and I just want to give you a little bit of updates as to what we are doing to try to manage. In our central zone here, which is based out of Red Deer, over the last 2 weeks, we've seen an 85% increase in the number of COVID cases. We still have relatively low hospitalizations, but we are planning for an onslaught of admissions. We know that COVID-19 disease does not present with a very sick person at the very first day typically. Most people will get worse around day 7-8, which means that positive tests today over the next week could result in unmanageable numbers of admissions to our hospital. If you have a loved one in hospital, you may find that they are discharged as quickly as possible right now. Of course, we would never discharge somebody who's not safe to be at home, but we have been asked to create additional spaces in our center to accommodate increased admissions that are going to be required across the zone. As well, you may have a loved one that is waiting for a nursing home placement somewhere such as Drumheller and be told that they're going to be moved up to Castor or Coronation because that's where there's an empty bed. It is much safer in general for our people to be out of the acute care hospitals, where we take care of the sickest of the sick patients, and in these nursing home settings where we can. So you may be asked to allow your loved one to move to a different center. Please be accommodating in this instance. What we really want to do is make sure that Access to places like intensive care units or specialty pulmonary, meaning lung units, in the cities are empty, and so we're going to be noticing people maybe not in their home sites as often. Right now, we are not considered a watch area because we have fewer than 10 cases and fewer than 50 per 100,000 cases, and so our visiting policies at our hospital have not changed. If there are increased outbreaks here in Hanna or our case numbers rise, you will notice that there are going to be updated visitor policies for the nursing home and the hospital. So just keep in mind that I'll give an additional updated message if that were to be required. One of the numbers that Dr. Hinshaw reports on regularly is the number of deaths that have occurred across our province because of COVID-19. I want you to know that my experience with the disease, because I have had patients with COVID-19, is not that a patient has died. I'm grateful for that. But me and patients in Hanna and area are dealing with other significant side effects of disease even after they have relatively recovered. So death is not the only bad outcome that we see. I have patients suffering with long-standing lung function problems where they can't breathe as well as they should breathe. Patients who have been in the intensive care unit that are struggling with mental health, with physical strength, meaning weakness in this case. People who have hair loss, people who are struggling with nightmares and mental health are a particularly prominent issue. Stigma around the community. You may have seen some newspaper articles detailing cardiac inflammation. There are studies out there indicating that even people with no symptoms or low symptoms can develop myocarditis, inflammation of the heart muscles. Not everybody is going to have these adverse side effects, but I want you to realize that not all bad things come when people die. There are other effects that we are dealing with in the community. I know you're tired and you don't want to wear your masks everywhere, and we're all hoping that we get to spend Christmas with our family. But please remember to be safe. We're out there trying to protect you in the hospital and clinic setting. All physicians are working right now, as are most of our nursing staff. None of them are currently sick with COVID, but we all have tests from time to time because of our toddler who has a fever, or ourself who maybe has a tummy bug. So please be kind. Let's move into December trying to make sure our community stays happy and healthy. Bye for now.